What changes happen in the body as we age? Many changes can occur in the body at various levels as we age. These changes are not necessarily signs of disease, but they may cause discomfort. While aging is inevitable, understanding these changes and living a healthy lifestyle can reduce their impact. Your skin is changing, and it's not just wrinkles. What's really happening under the surface as we age? Brace yourself, because these changes are more dramatic than you think, and they're happening every single day, right before your eyes. As we grow older, our skin undergoes a variety of changes that may surprise you. One of the most noticeable changes is the loss of elasticity. Over time, the skin becomes less firm and more prone to sagging. This loss of elasticity is due to a breakdown in collagen and elastin, the two proteins responsible for keeping our skin tight and youthful. As a result, you may begin to see more wrinkles forming, especially around the eyes, mouth, and forehead. Another major change is that the skin becomes thinner. This thinning can make the skin more fragile and easier to damage. Even minor bumps can cause bruises, and wounds may take longer to heal. The protective barrier of the skin weakens, making it less able to shield the body from environmental stressors. In addition to thinning and loss of elasticity, older skin tends to become much drier. This dryness happens because the skin's oil glands produce less natural oil as we age. Without adequate moisture, the skin may feel itchy, tight, and uncomfortable. Dryness can also enhance the appearance of fine lines and cause flaking or scaling. Age spots, also known as liver spots, may start to appear. These flat, brown patches develop due to years of sun exposure and tend to show up on areas frequently exposed to the sun, such as the face, hands, arms, and shoulders. Another common issue is the increased visibility of skin tags, small, benign growths that appear on the neck, chest, or underarms. While harmless, they can be bothersome or cosmetically concerning for some. These changes are completely natural and part of the aging process. While you can't stop time, you can slow its visible effects. Staying hydrated, using sunscreen, moisturizing daily, and eating a healthy diet can help your skin stay vibrant and strong. So, the next time you look in the mirror and notice something new, remember, your skin is telling your story. Take care of it, and it will continue to protect you for years to come. Ever wonder why your back aches more often, or why your knees feel stiffer as the years go by? What's really happening inside your body as you age? Let's take a closer look, because the changes to your bones, joints, and muscles might shock you. As we age, one of the most significant physical changes occurs in our bones, joints, and muscles. Bones tend to lose density and may shrink in size. This natural decrease in bone mass makes them more fragile and more prone to fractures. Osteoporosis becomes a common concern, especially in older adults, as bones lose their strength and structural integrity. Joints also go through noticeable changes. Over time, the cartilage that cushions your joints wears down, leading to stiffness, discomfort, or even pain. This process can make everyday movements like walking, bending, or reaching more difficult. Inflammation of the joints, commonly known as arthritis, can further reduce flexibility and contribute to chronic pain. Muscles are not exempt from the aging process either. As we grow older, muscle mass and strength gradually decrease, a condition called sarcopenia. This loss can begin as early as your 30s and accelerate with age if not properly addressed. Muscles may also become less toned and more susceptible to fatigue. You may find that activities that were once easy now require more effort and leave you feeling sore. These changes don't just affect your mobility, they also impact your posture, balance, and overall physical performance. Reduced bone density, weakened muscles, and joint pain together can lead to a higher risk of falls and injuries, particularly in older adults. However, while these changes are common, they're not entirely unavoidable. Regular physical activity, including weight-bearing exercises and resistance training, can help maintain bone strength and muscle mass. A healthy diet rich in calcium, vitamin D, and protein can also support bone and muscle health. Staying active and maintaining a strong body is one of the most effective ways to delay or minimize age-related physical decline. Your body may change with age, but with the right care you can stay strong, flexible, and resilient well into your later years. Remember, Movement is medicine, and it's never too late to start. Have you ever noticed how simple movements like standing up quickly or walking across the room start to feel riskier as we age? What if one wrong step could change everything? Let's uncover the silent shift happening inside your body. The decline in mobility and balance. Mobility and balance are two of the most critical aspects of physical health that become increasingly affected with age. These functions rely heavily on the condition of your bones, joints, muscles, and nervous system. As we get older, the natural wear and tear of our musculoskeletal system begins to take its toll. Muscle mass decreases, joints stiffen, and bones weaken. These physical changes are compounded by slower nerve signaling, which can delay your body's response time. All these factors combine to affect your ability to move freely and maintain stability. Even simple activities like walking, climbing stairs, or getting out of a chair can become more difficult. You might feel unsteady, or find that your coordination isn't as sharp as it once was. This isn't just inconvenient, it can be dangerous. Impaired balance significantly increases the risk of falls, which are one of the leading causes of injury among older adults. When a fall occurs, it can lead to serious consequences, such as bruises, fractures, and even long-term disability. In fact, many seniors never fully recover from fall-related injuries, making mobility and balance essential to preserving independence and quality of life. But the good news is you're not powerless. There are effective ways to maintain and even improve your mobility and balance as you age. Regular physical activity, especially exercises that focus on strength, flexibility, and balance like yoga, tai chi, or light resistance training, can significantly enhance stability and coordination. Engaging in these activities keeps your muscles strong, your joints flexible, and your reflexes sharp. Also, making small adjustments at home, such as removing tripping hazards, using grab bars, and wearing supportive footwear, can create a safer environment. Aging may affect how you move, but it doesn't mean giving up your freedom. By staying active and aware, you can protect yourself from falls and continue to enjoy the independence and mobility you deserve. Have you looked in the mirror and noticed your body shape changing as you age even if your weight hasn't? What's happening beneath the surface might surprise you. As we grow older, noticeable changes occur in our body shape due to the natural aging process. These changes are primarily caused by age-related transformations in bone structure, muscle mass, and fat distribution. While this is a normal part of aging, the physical results can be unsettling for many people. One of the most significant changes is that the body may become shorter in height. This occurs as a result of bone density loss and compression of the spinal vertebrae. Over time, these changes can make a person appear shorter and slightly hunched. The natural curvature of the spine can become more pronounced, especially in the upper back, contributing to a stooped posture. In addition to bone changes, muscle mass also declines, a condition known as sarcopenia. This loss of muscle not only affects strength but also contributes to an overall shift in body composition. As muscle mass decreases, the body burns fewer calories at rest, slowing the metabolism. This can lead to increased fat accumulation, particularly if physical activity is reduced. Another key transformation is the redistribution of fat in the body. Even without significant weight gain, fat tends to shift from areas like the arms and legs to the abdominal region and buttocks. This shift can make the waistline thicker and the body's proportions different from earlier years. It becomes more challenging to maintain an ideal weight or slim figure, even with consistent diet and exercise. These age-related changes in body shape can affect self-esteem, comfort, and mobility. But understanding that this is a normal biological process is crucial. It's also important to focus on healthy aging rather than trying to look like your younger self. Although we can't stop the aging process, we can influence how it affects our bodies. Staying physically active, maintaining a balanced diet rich in protein and calcium, and engaging in strength training can help preserve muscle mass and bone density. With the right approach, you can age with strength, confidence, and grace. Your body may change, but your ability to care for it remains powerful. Own your shape. Own your strength. Ever looked at your reflection and wondered, when did my face start to look different? It's not just wrinkles. Aging transforms the entire facial structure, And what's really happening might surprise you. Facial changes are one of the most visible signs of aging. These changes go beyond simple fine lines and wrinkles. They reflect a deeper transformation in the skin, muscles, fat, and bone structure. As we age, the skin loses elasticity, becomes thinner, and develops more prominent wrinkles and age spots. Sun exposure over the years also plays a major role, accelerating these visible signs of aging. But that's just the surface. One of the most dramatic changes is the loss of volume in the face. Over time, both facial fat and bone mass diminish. This volume loss affects the cheeks, temples, under-eye area, and jawline. When the underlying support from fat and bone fades, the skin begins to sag. This can make the face appear hollow in some areas and heavier or droopier in others, especially the lower half of the face. This shifting structure leads to the overall facial contours changing. The firm, youthful V-shape of the face starts to invert, turning into more of a square or rectangular shape. The jawline softens. The once high cheekbones may flatten. Combined with gravity, these changes result in jowls, sagging cheeks, and a heavier appearance around the chin and neck. In addition, expression lines such as crow's feet, smile lines, and forehead creases deepen due to repetitive facial movements and loss of skin elasticity. Age spots, small skin tags, and uneven texture also become more common, especially in sun-exposed areas like the forehead and cheeks. Despite all these changes, it's important to remember that aging is a natural and beautiful process. Everyone's face tells a unique story shaped by time, experiences, and emotions. While these changes can affect self-image, understanding what's happening beneath the surface allows for acceptance and, when desired, action. Through hydration, a balanced diet, sun protection, and a healthy lifestyle, it's possible to slow the signs of aging and maintain a vibrant appearance. Your face is the story of your life, not just age. Embrace every line. Celebrate every change. Have you ever noticed how aging doesn't just change your appearance but also affects your smile in surprising ways? Teeth and gums undergo major changes as we grow older, and understanding these transformations is key to maintaining long-term oral health. As we age, the enamel that protects our teeth begins to wear down, making teeth more susceptible to decay, cracks, and sensitivity. Years of chewing, grinding, and exposure to acidic foods and beverages contribute to this gradual erosion, which can also make teeth appear yellowed or dull. The nerves inside the teeth may also shrink, making it harder to detect cavities or other problems until they become more serious. Gums are not immune to aging either. One of the most common issues is gum recession, where the gums gradually pull away from the teeth, exposing more of the tooth root. This can lead to increased sensitivity, especially to hot or cold temperatures, and can make teeth appear longer than they used to. Receding gums also create pockets where bacteria can collect, increasing the risk of gum disease or infections. Dry mouth is another common concern among older adults. Often caused by medications or health conditions, reduced saliva flow can affect your ability to chew and swallow, and can also contribute to cavities, since saliva plays a key role in neutralizing acids and washing away food particles. In addition, tooth loss becomes more common with age, either due to decay, injury, or gum disease. Missing teeth not only affect appearance and confidence but can also impact chewing, speech, and overall oral alignment. Dentures, bridges, or implants may become necessary to restore function and aesthetics. Routine dental care becomes even more essential with age. Regular brushing, flossing, and professional cleanings are critical to prevent serious problems. Lifestyle choices such as avoiding tobacco, limiting sugar, and eating a balanced diet rich in calcium and vitamin D can also help support healthy teeth and gums. Ultimately, maintaining your oral health is not just about having a nice smile. It is closely linked to your overall well-being. Poor dental health has been associated with heart disease, diabetes, and respiratory infections. So paying attention to your teeth and gums as you age is an important part of staying healthy, happy, and confident. Your smile is one of the first things people notice, and it deserves lifelong care. Have you ever looked in the mirror and noticed your hair becoming thinner or your nails more brittle over time? These subtle changes are common signs of aging that many people experience as the years go by. Hair and nails are made up of keratin, a protein that provides structure and strength, but as we age, the production of this protein slows down. This can lead to hair that is thinner, drier, and more prone to breakage. Some people may notice increased hair shedding or even areas of hair loss, especially on the crown or temples. Hair may also lose its natural color, turning gray or white due to a decrease in melanin, the pigment responsible for hair color. This process is largely determined by genetics, although stress and overall health can also play a role. For nails, aging can cause them to grow more slowly and become dull or yellowed. They may develop ridges or become more brittle, splitting or breaking more easily than before. Fingernails and toenails can also become thicker or change shape due to changes in blood circulation or fungal infections that become more common with age. The cuticles may recede and the surrounding skin may become drier and more prone to hangnails or irritation. While these changes are natural, they can be managed with proper care. Gentle hair care routines using moisturizing shampoos and conditioners can help reduce dryness and breakage. Avoiding excessive heat styling or harsh chemicals can also preserve hair health. Some people choose to dye their hair or use volumizing products to maintain a youthful appearance. For nails, keeping them trimmed, moisturized, and protected from harsh cleaning products or frequent water exposure can help maintain strength and flexibility. A diet rich in vitamins and minerals, especially biotin, zinc, and iron, supports healthy hair and nail growth. In some cases, supplements or medical treatments may be recommended by healthcare providers. Paying attention to changes in your hair and nails can also give you clues about your overall health, as conditions like thyroid disorders or nutritional deficiencies often show early signs through changes in these areas. By taking small but consistent steps, you can keep your hair and nails looking their best and feel more confident as you age gracefully. As we grow older, one of the most profound yet often invisible changes happens within our hormones and endocrine system. This complex network of glands produces and regulates hormones that control many vital functions including metabolism, growth, reproduction, mood, and energy levels. With age, the production and balance of hormones naturally shift, which can affect how our bodies function and feel day to day. In women, menopause is a major hormonal milestone typically occurring in their late 40s or early 50s. During this period, estrogen and progesterone levels decline significantly, which can lead to hot flashes, night sweats, mood swings, and changes in bone density. Men also experience hormonal changes known as andropause, where testosterone levels gradually decrease, leading to reduced muscle mass, lower libido, fatigue, and sometimes depression. These changes may not be as abrupt as menopause but can have a significant impact over time. The thyroid gland, which regulates metabolism, may also become less active in older adults, leading to symptoms like weight gain, cold intolerance, and fatigue. Insulin production or sensitivity can decline with age, increasing the risk of type 2 diabetes. Additionally, the adrenal glands, which manage the stress hormone cortisol, may respond differently in aging bodies, possibly affecting how we handle stress or recover from illness. Hormonal changes can also affect sleep patterns, mood regulation, and even cognitive function. As hormone levels shift, it may become harder to fall asleep or stay asleep, leading to tiredness during the day. Some people experience increased anxiety or irritability due to fluctuating hormone levels. While these changes are natural, they are not always easy to cope with. Lifestyle habits like regular exercise, a balanced diet, stress management, and adequate sleep can help regulate hormone levels. In some cases, hormone replacement therapy or other medical interventions may be recommended by healthcare providers to manage symptoms. Regular checkups and hormone level screenings can be important, especially if you notice unusual changes in mood, energy, weight, or overall health. Understanding how the endocrine system works and how it changes with age can empower you to take proactive steps toward maintaining hormonal balance and overall well-being. Paying attention to these invisible yet powerful shifts in your body can make a meaningful difference in how you age and how you feel every day. Memory is one of the most noticeable aspects of cognitive function that changes as we age. While some decline in memory is a normal part of aging, it can be worrying when everyday forgetfulness starts to increase. You might misplace your keys more often, forget names or appointments, or struggle to recall words that were once easy to remember. These changes can be frustrating and sometimes even scary, especially when they interfere with daily life. However, not all memory loss is a sign of something serious like dementia. Age-related memory changes are often linked to slower information processing and reduced efficiency in storing new memories. The brain, like the rest of the body, undergoes structural and chemical changes over time. The hippocampus, a part of the brain involved in forming new memories, may shrink slightly. Blood flow to the brain can decrease, and certain neurotransmitters may become less effective. All of these factors can contribute to slower recall and mild forgetfulness. Stress, lack of sleep, depression, and poor nutrition can also negatively affect memory. On the other hand, staying mentally and physically active can help maintain cognitive health. Engaging in activities like reading, solving puzzles, learning new skills, or even socializing regularly can strengthen neural connections and support memory retention. Exercise boosts blood flow to the brain and supports the growth of new brain cells, while a healthy diet rich in fruits, vegetables, lean proteins, and healthy fats can nourish brain function. Sometimes medical conditions such as thyroid problems, vitamin deficiencies, or side effects from medications can mimic memory problems. That is why it is important to talk to a healthcare professional if memory issues become frequent or interfere with daily activities. There are also techniques to support memory, like using planners, setting reminders, repeating information aloud, or associating names with images. These strategies can help manage normal age-related memory changes and reduce frustration. The important thing to remember is that occasional forgetfulness is a normal part of life for many people as they get older. While you may not remember every detail as quickly as before, you can still lead a sharp, vibrant, and mentally active life. With healthy habits and a proactive approach, your memory can remain one of your greatest assets well into your later years. The immune system is a complex network of cells, tissues, and organs that work together to defend the body against harmful invaders like bacteria, viruses, and other pathogens. As we age, this system does not function as efficiently as it once did. This natural weakening of the immune response is known as immunosenescence. Older adults are more likely to get infections and take longer to recover from illnesses. They may also respond less effectively to vaccines and are at a greater risk for complications from common diseases like the flu or pneumonia. The decline in immune function is partly due to changes in the production and function of white blood cells, which are critical for identifying and destroying pathogens. The thymus, an organ responsible for producing T cells, gradually shrinks and becomes less active with age. This results in a reduced number of new T cells, which are important for adaptive immunity. Additionally, chronic low-level inflammation becomes more common with age and can further impair the immune response. This inflammation, known as inflammaging, may contribute to age-related conditions such as heart disease, diabetes, and cancer. Despite these changes, there are many ways to support a healthy immune system throughout life. Regular exercise can enhance circulation and promote the movement of immune cells throughout the body. A balanced diet rich in vitamins and minerals, especially vitamins C and D, zinc, and antioxidants, can help maintain immune function. Getting enough sleep, managing stress, and avoiding smoking or excessive alcohol intake also play important roles in immune health. Vaccinations remain a crucial tool for protecting older adults from serious infections. Annual flu shots, pneumonia vaccines, and shingles vaccines are especially important as we age. It is also wise to stay up to date on booster shots recommended by healthcare providers. In some cases, immune problems may be linked to underlying health conditions or medications that suppress the immune response. If frequent or severe infections occur, it is important to consult a doctor to evaluate immune health. While the immune system does change with age, adopting a proactive and healthy lifestyle can strengthen its ability to defend against illness. Staying informed, practicing good hygiene, and making smart health choices can all contribute to a strong and resilient immune system that supports overall well-being in later years. Hearing is a vital sense that connects us to the world around us. It allows us to communicate with others, enjoy music, stay safe by alerting us to dangers, and engage fully in daily activities. However, as people age, hearing often declines gradually, a condition known as presbycusis. This type of age-related hearing loss typically affects both ears and progresses slowly over time. It is most commonly caused by changes in the inner ear, including the loss of hair cells in the cochlea that help transmit sound signals to the brain. In addition to the loss of sensitivity to high-frequency sounds, people may also find it harder to distinguish speech, especially in noisy environments. Voices might seem muffled, and background noise can make conversations more difficult to follow. Some individuals may also experience tinnitus, a persistent ringing, buzzing, or hissing sound in the ears. This can interfere with concentration, sleep, and overall quality of life. Factors that contribute to hearing loss include long-term exposure to loud noises, genetic predisposition, certain medications, and underlying health conditions such as high blood pressure or diabetes. While age-related hearing loss is common, it is not inevitable, and steps can be taken to protect hearing and manage changes. Using ear protection in noisy environments, limiting exposure to loud music or machinery, and avoiding the use of cotton swabs in the ear canal can help prevent damage. Regular hearing tests are important, especially for older adults, to detect changes early and take appropriate action. Hearing aids can significantly improve hearing and communication for many people with hearing loss. These devices amplify sounds and make it easier to follow conversations, especially in group settings. In some cases, cochlear implants or assistive listening devices may be recommended. It is important to seek guidance from a healthcare provider or audiologist to determine the best solution. Addressing hearing loss promptly can prevent social isolation, depression, and cognitive decline, which are sometimes associated with untreated hearing impairment. Staying socially active, participating in conversations, and using strategies like facing the speaker and reducing background noise can also support better communication. Understanding the changes in hearing that come with aging and taking proactive steps can greatly enhance a person's ability to remain engaged, safe, and connected throughout life. Vision is a critical sense that allows us to interpret the world around us. It helps us recognize faces, read, drive, and navigate safely. However, as people age, changes in vision are common and often become more noticeable after the age of 40. One of the most frequent age-related changes is presbyopia, a condition in which the eye gradually loses the ability to focus on nearby objects. This occurs due to the hardening of the lens inside the eye, making tasks such as reading small print or threading a needle more difficult. Many individuals begin to rely on reading glasses or bifocals to manage this change. Another common issue is dry eyes, which can cause discomfort, redness, and blurred vision. This happens when tear production decreases with age or the quality of the tears changes. Age also increases the risk of more serious eye conditions, such as cataracts, which cause clouding of the eye's lens. Cataracts can lead to blurry vision, sensitivity to light, and difficulty seeing at night. Fortunately, cataract surgery is a safe and effective treatment that can restore clear vision. Other potential age-related eye conditions include glaucoma, which results from increased pressure inside the eye and can damage the optic nerve, and age-related macular degeneration or AMD, which affects central vision and can make reading or recognizing faces difficult. Regular eye exams are essential for detecting these conditions early, as they often develop without noticeable symptoms in the beginning. Wearing sunglasses to protect against UV rays, eating a balanced diet rich in antioxidants, and managing chronic conditions like diabetes and high blood pressure can all contribute to maintaining healthy eyes. It is also important to avoid smoking, which is a significant risk factor for many eye diseases. If vision changes are noticed, it is crucial to consult an eye care professional. Timely diagnosis and treatment can preserve vision and improve quality of life. Maintaining eye health is not only about preventing disease but also about staying active and independent. By taking proactive steps, individuals can continue to enjoy clear vision and participate fully in everyday activities as they age. Taste and smell are closely linked senses that play an important role in how we experience food and the world around us. These senses contribute not only to the enjoyment of eating but also to safety by helping us detect spoiled food, smoke, or gas leaks. As people age, it is common for both taste and smell to decline gradually. This reduction can be subtle or more pronounced, depending on the individual and their health. The number of taste buds on the tongue decreases with age, and the remaining ones may shrink and become less sensitive. This means that older adults may find that foods taste blander or less intense. Similarly, The sense of smell can weaken due to changes in the nose's structure and a reduction in the number of nerve endings that detect odors. Illnesses, medications, dental problems, and smoking can also affect these senses. For example, certain medications used to treat high blood pressure, depression, or infections may cause dry mouth or alter taste perception. Chronic conditions like sinus infections, Alzheimer's disease, or Parkinson's disease can also impair taste and smell. Loss of these senses can lead to a decreased appetite, poor nutrition, and a diminished quality of life. People may use more salt or sugar to make food taste better, which can be problematic for those with health issues such as hypertension or diabetes. To help preserve taste and smell, it is important to maintain good oral hygiene, stay hydrated, avoid smoking, and have regular checkups with healthcare providers. Adding herbs and spices or trying different food textures can help enhance flavor without relying on excess salt or sugar. If there is a sudden or severe change in the ability to taste or smell, it should be evaluated by a healthcare professional, as it could be a sign of an underlying condition. Though some decline in taste and smell is a natural part of aging, there are strategies to adapt and continue enjoying food and scents. By being mindful of these changes and seeking appropriate care, older adults can support their nutritional health and maintain an enjoyable eating experience throughout life. As people age, changes in bowel and bladder function are common and can significantly affect daily life. These changes may include increased frequency, urgency, or difficulty in controlling urination or bowel movements. The muscles in the bladder and the pelvic floor may weaken over time, reducing the ability to hold urine effectively. This can result in urinary incontinence, which is more common in older adults, especially women. Additionally, the bladder's capacity to store urine may decrease, leading to more frequent trips to the bathroom, particularly at night. For men, prostate enlargement can interfere with urine flow, causing dribbling or incomplete emptying of the bladder. Bowel function may also change with age. Slower movement of the digestive tract can lead to constipation, which is a frequent complaint among older adults. A lack of physical activity, insufficient fiber intake, dehydration, and the use of certain medications can contribute to this condition. Some medications, such as pain relievers, antacids with calcium or aluminum, and certain antidepressants, can further complicate bowel and bladder health. Nerve function may also decline, making it harder to sense when it is time to use the bathroom or to control the muscles required for elimination. These changes can lead to embarrassment, social withdrawal, and a decreased quality of life if not addressed. However, there are effective ways to manage and even improve bowel and bladder function. Drinking plenty of fluids, eating a high-fiber diet, and engaging in regular physical activity can support digestive and urinary health. Pelvic floor exercises, often referred to as Kegel exercises, can help strengthen muscles and improve bladder control. In some cases, medical treatment or physical therapy may be recommended. If symptoms like frequent urination, pain, blood in the urine, or severe constipation occur, it is important to seek medical attention promptly. These symptoms could indicate underlying conditions that require treatment. Aging does not mean losing control over bowel and bladder health. With awareness, healthy habits, and medical guidance when necessary, individuals can maintain independence and comfort in their daily lives. Addressing these changes early and openly can reduce stigma and improve overall well-being for older adults. As people age, sleep patterns often change, and it is common for older adults to experience lighter and shorter sleep. They may find it more difficult to fall asleep or stay asleep through the night. These sleep disruptions are influenced by both physiological and lifestyle factors. The body's internal clock, known as the circadian rhythm, can shift with age, causing older adults to feel sleepy earlier in the evening and wake up earlier in the morning. This natural change does not necessarily mean that they need less sleep. Most older adults still require about 7 to 8 hours of sleep per night for optimal health and functioning. Sleep architecture also changes with age. There is a decrease in deep sleep, which is the most restorative stage, and an increase in lighter sleep stages, making individuals more prone to waking during the night. Medical conditions such as arthritis, chronic pain, diabetes, and neurological disorders like Parkinson's disease can interfere with sleep quality. Additionally, Medications commonly used to treat these conditions may have side effects that affect sleep. Sleep disorders such as insomnia, sleep apnea, and restless leg syndrome become more prevalent with age and can significantly impact quality of life. Lifestyle factors also play a role. Reduced physical activity, limited exposure to natural light, and irregular sleep schedules can all contribute to poor sleep. Napping during the day, especially for extended periods, can also make it harder to sleep at night. Despite these challenges, there are effective strategies to improve sleep in older adults. Maintaining a consistent sleep schedule, creating a comfortable and quiet sleep environment, limiting caffeine and alcohol intake, and increasing daytime physical activity can all help. Exposure to natural light during the day and winding down with a relaxing routine before bedtime can also support better sleep. If sleep problems persist, it is important to consult a healthcare provider to rule out underlying medical issues or sleep disorders. Good sleep is essential for physical health, cognitive function, and emotional well-being. By understanding the changes that occur with aging and adopting healthy sleep habits, older adults can improve their sleep quality and overall quality of life. In conclusion, as we journey through the changes that come with aging, it's clear that our bodies and minds undergo remarkable transformations. From skin changes and muscle adjustments to shifts in our immune system, memory, and overall health, each stage of life brings its own set of challenges. However, with awareness, lifestyle changes, and medical guidance, many of these challenges can be managed effectively. Our bones, joints, and muscles become more susceptible to wear and tear, but staying active, strengthening them, and maintaining flexibility can greatly reduce discomfort. Likewise, changes in our body shape and facial features are a natural part of aging, but with proper care, we can embrace these changes with confidence. The role of our hormones, the health of our teeth and gums, and even our hearing and vision also require attention, as they can significantly impact our day-to-day lives. More than ever, it's important to focus on maintaining a healthy balance, staying active, eating well, and taking care of our mental health. Practices like improving sleep quality, boosting immune function, and nurturing our memory can go a long way in helping us stay vibrant and engaged with the world around us. Ultimately, aging is not something to fear, but a journey to be embraced with the right knowledge and tools. By adopting healthy habits, seeking support when necessary, and taking proactive steps to improve our overall well-being, we can enjoy a fulfilling and enriched life at any age. Thank you for joining me on this exploration of the changes we experience as we age. Remember, the key to aging gracefully is a balance of knowledge, care, and self-compassion. If you found this information helpful, don't forget to subscribe to Golden Wellbeing for more valuable insights on health and wellness. Be sure to share this video with your family and friends so they can also benefit from these tips for a healthier, happier life. Stay tuned for more content, and let's continue this journey toward better health together.